Scar revision involves taking care of a visible scar and making it less obvious. Essentially, what makes a scar obvious are several things. Number one, the scar could be visible because there is a straight line. A straight line makes a scar very obvious because your eye can easily follow it. The second reason a scar is visible is that a scar could be either puckered in or elevated. So there's what's called a contour deformity, and that could be a reason why your scar is obvious. The third reason a scar could be obvious is that it pulls or tugs at a part of the face that causes a contracted look, like it could pull the lip down or distort another surrounding area. Or there also could be other related issues such as color, redness, brown colors, loss of skin color, or increased skin color, and all those factors together makes a scar obvious. The principle of good scar revision is not to completely eliminate the line or the contour or I should say eliminate the presence of the scar, but to make it so that your eye during a normal social encounter really doesn't see the scar at all. Basically, here are a few things to understand. If you've had a scar from a traumatic accident of some kind early on, and you're a few weeks after, say like an emergency room physician closed it, it's not a good idea at that point necessarily to go ahead and do a scar revision. It's too early. Oftentimes a scar that you look at in the first few weeks to months after an injury really, even though it may look very swollen or have a red color or a brown color, will eventually, hopefully, completely fade away, and therefore you don't really need surgery to take care of it. The minimum time I would wait to intervene surgically is 6 months, and that would be in situations where I know it's just not going to get better, and or it looks like it's getting worse. In that case, I would help intervene earlier. But in most cases, I wait at least a year before I decide to do something for a scar. Now, there is an exception to that. The exception is really something that doesn't have anything to do with actual surgery. It's if the scar is turning a little bit redder. In that case, sometimes a laser can help soften the redness. If it's turning a little bit browner and there's a little bit what we call hyperpigmentation, that can be helped if there's a lot of sun exposure using a bleaching product to help the color. If the scar is getting a little bit thicker and it feels like there's what we call hypertrophic scar or an early keloid, then the treatment for that is not surgery, but injecting products to help soften it. And I have both steroids and non-steroidal techniques to just basically office procedure inject it and to flatten and soften it if need be. Now, if we're looking at a scar revision about a year or more after an accident and we're looking to make that scar look better, there are many techniques out there to make a scar look better. Remember that we need to address line and contour and contraction as the major things to help a scar look better. I'm going to talk about some of the techniques out there that are available for me to help you with a scar, and I'm going to walk you through some of the methods out there. And of course, during a personal consultation with me, I'll be able to figure out exactly which method would be ideal for you. Let's start with what's called a geometric broken line repair. Big, long expression for a technique in that, my opinion, is really the Cadillac of all scar closures. Essentially, what the principle of a geometric broken line repair is to take a very obvious line and make that line so complicated in terms of making it zigzaggy that your eye can't visually follow it. And when that happens, you really get a really good result. I brought a little chalkboard type of billboard type of thing here for me to illustrate what a geometric broken line repair is. So remember, if you've got a straight line, that's something your eye just darts across and sees. But what a geometric broken line repair does, it's a very meticulous closure, and it takes squares like this, triangles, and trapezoids, and he regularly places them in order across the scar, and it's interdigitated with the same shapes on the other side of the scar, so that eventually after closure the scar just looks irregular like this, and as that heals your eye can't follow the incision line. That's a principle of a geometric broken line repair. That does require a little tissue removal. The other technique to break up a line is what's called a Z-plasty. A Z-plasty is basically taking little cuts on either side and rolling them in like this so that the line again looks irregular. It's not quite as irregular as a geometric broken line, but the times I would use a Z-plasty would be, for example, if there's less tissue that I can remove, I would use a Z-plasty. Or the other indication for a Z-plasty is if there is a contraction of the, like I told you at the lip, that I need to extend, it actually extends the incision. It also redirects the scar contracture forces. And again, that's something probably that you really need to sit down with me and for me to evaluate your scar to make a decision about which method would be best. And then sort of a compromise between the two is what's called a running W-plasty. And essentially what that is something like this, which then when you close it becomes something like this. And then following your scar revision, or after a period of about 6 weeks to 2 months, if the scar edges are still a little bit visible, at that point I may elect to do what's called mechanical dermabrasion, which is really sanding down the edges to smooth it out. And that's something you may or may not need, and I have to basically take a look at you before I make that decision. Remember that when I'm thinking about scar revision, initially I'm taking a very well-healed, barely perceptible scar that is matured over a period of maybe a year or 2 or 3 years, and then doing surgery on it. So I'm actually taking you a few steps back. So I'm taking that fine line that's barely visible and transforming it into something that's quite visible and also irregular, that's going to attract attention. And that may take several months to even a year to really fade to the point where it's barely noticeable. And obviously the ultimate goal is that that scar becomes really imperceptible, but during the early phase of it, it will look worse before it looks better, and that may take several months to even a year to really get there. And that's something you really got to understand when you're looking at scar revision. I look forward to meeting you in my office and talking to you about some of the options we've discussed, and hopefully some of these more difficult ideas that I've expressed to you today will be a little bit clearer when I sit down and talk to you.